Hi, everyone. It's week 6. Can you believe that already? Wow. We are really zooming. Get it? We're in a Zoom and we're zooming through this term. And I apologize because that squeaking in the background is my son, Oliver, a Yorkshire Terrier who wants dinner, but he's going to have to wait because you guys come first. Okay. So this week we are talking about medical malpractice and liability. And of course, as coders, we do not really have an issue with malpractice. However, we do have legal liability. And the way to prevent liability issues is to have a comprehensive compliance plan. Now, you may think about this about any company that that you're working for, excuse me, is going to have a policy manual, your employee handbook, which informs the employee, under this circumstance, you will do this, you will do this, you will not do that. Okay, you will come for your shift or your appointed time on time. You will dress appropriately. You will not just not show up and you must call, you get this, whatever. Okay. Well, we have to remember that in addition to those particulars for every employee, we need to make certain that the facility has a documented obligation to educate and enforce that all staff members are being legally compliant. So welcome, Nikki. Are you in a garden?
No, I'm trying to change this background. I was playing around with it.
I need to learn how to do that. Okay. But all right, so we're talking about the elements of an effective compliance plan, because this is how you are going to support your facility and the individuals within it, including yourself, to make sure that you are complying with the legal aspects of your responsibilities. And our responsibilities as medical coding professionals are tied up with money. As you know, we control the revenue stream into the facility. When we do our job well, the money flows in, which is great, so it's there for our paychecks and our raises, right? And bonuses. We love that. Okay. When we do our job poorly, the money does not flow. And we not only endanger the facility, our own jobs, and everybody else's job, we endanger our patients from getting stuck with a bill that they shouldn't have to pay. And we endanger everyone, including ourselves, with regard to legal repercussions, such as fines, penalties, jail, or prison time. Okay, so we're just going to talk about 7 easy ways. It's not easy though, but easy ways to ensure that we have a good compliance plan, because that's where you got to start. You got to start with, what's our middle name, right? Documentation. We must have documentation to support that we are mandating that everybody follow the law. None of this wink, wink, nudge, nudge, because that's how you wink, wink, nudge, nudge, jail, jail, prison, prison. Okay. All right. So the first part of an effective compliance plan is to establish compliance standards and procedures. So this is for, and it's good to have a committee to work on this, not necessarily just have the one person do this, although you could, okay. But you want to make sure that you sit down and you make a list of all of the standards that you must comply with, and how to go about complying with that. So right off the top of my head, I'm going to say HIPAA's security rule, HIPAA's privacy rule. You know about the 3 safeguards, the 3 categories of safeguards that you are required to comply with. The administrative safeguards, the physical safeguards, and the technical safeguards to protect protected health information in your system, in your facility, in your EHR. But we as coders have to know those things and ensure that we are keeping things protected and private. For example, it's not unusual for a patient to call in and say, I just got this invoice and I want to know more about it. And we have to remember that it seems like it's just a question about this bill that I got, you know, and it's the patient. They know when they came to see which doctor for what, whatever. Okay. But the fact is that you don't know that it's the patient on the other side of the phone. We must protect privacy. We must. And as my students, I want to make sure that you never say, well, contact your insurance company. It's your issue between them and you on your policy. It's not our job. Because remember that the reason the claim was denied or reduced is because possibly because you as a coder did not do your job. And remember that eligibility and verification is required for the facility to do when the patient first comes in. So that if a patient is getting a surprise bill, it means that maybe you didn't do your job. Maybe one of the coders in your department did not code accurately. Now, we're all human, you know that, right? I am. Look, see, I'm human. I'm human. Okay. But when we double check and triple check our work, we reduce the number of errors. Okay. But first, you got to know what the rules are. So we have HIPAA privacy rule. We have HIPAA security rule. Remember, IT is within the Health Information Management Department. All right. We also have the False Claims Act that you have to make certain everybody in your department is complying with. We also have Stark and the anti-kickback laws when it comes to physician referrals. Okay, so that's the first step, is to identify exactly what you have to comply with and how do you comply with it. Because if you don't have, that's your checklist, right? Okay. Then you're going to assign responsibility for two specific high-level individuals. So this could mean the head of a department. This could mean a lead coder or multiple lead coders. And actually, very often you will see this being divided up. Okay. So you might assign some of this responsibility to the clinical documentation improvement department, part of the health information management department. You might align some of it to the IT section, the actual other coders, you know, the technical coders, not the medical coders like we are. All right. And some of it is going to land squarely in our laps. Okay, so you might say, have the lead coder make sure that everybody is up to date, make sure that everybody is using the latest code books, make sure that everybody knows the guidelines, make sure you're doing your training. Okay, make sure you help each other. All right, third, use due care to avoid delegation of authority to individuals with an inclination to get involved in illegal actions. Okay, so what does that mean is certainly background checks before you get hired and before you hire anybody new, but also be alert to things that may go on. And again, this part might be a little rare for just in the coding department itself. But if you have somebody working in your department that is desperate for money, maybe they have a boyfriend or a spouse who gambles or is a drug addict, or maybe they're a drug addict. The fact is that these people are primed to be paid off by bad people. Okay. And let's remember that even though somebody went to medical school or nursing school, it doesn't mean automatically that their character is clean. There are physicians, there are nurses, there are HIM directors who are not legal upstanding people, and they'll cheat the first chance they get. So it's very important that you know with whom you're working. If it's something in your control, then you might want to fire this person or make sure that they get reassigned to a job description where they don't have access to making serious errors. Okay. Whatever it might be. And if you can't, if you don't have the authority to get rid of these people who are inclined to do illegal things, and I'm not saying anything out of school here, because we have prisons and jails that are stocked full of people who don't have any problem doing illegal things. Okay. So if that's the case, then you need to extract yourself from that environment as soon as possible, or go report them to somebody who cares about legal, doing things properly and legally. Okay. This is really, really important, because people get swept into bad situations all the time, and sometimes they get coerced, they get talked into it. Sometimes it's a matter of association. Okay, is we know that 3 of the 4 coders in this department have been miscoding and siphoning off the money, or getting paid by the doctor or the nurse, whatever. Okay. And then they may assume that you're part of it. And then instead of proving that you are a part of it, you end up having to pay an attorney a lot of money to prove you were not a part of it. Okay. So for your own protection, you got to make sure that you're standing up for what's right. Okay. Any questions on the first 3?
No, ma'am.
Okay. Thank you. If you could move your camera down a little, your ceiling is very nice, but your face is nicer to look at. Thank I don't know, it's just me. The vent in your ceiling, it's okay, but I'd rather look at your pretty face. Okay. So
Can you see me?
I can. Thank you very much. Okay. Effectively communicate standards and procedures to all staff. And I mentioned before about training, and this is very important, that especially when you get to the point where you're the manager, the lead coder, or the manager, or even the director of the department, you need to make sure that the culture in your area, in your department, is one of honesty and legal action. And this is what they call a top-down thing. So when you can communicate, this is how you do it, and we're watching, and nobody will be permitted to do wrong things and get away with it. We're not sweeping this under the rug. This is important. When you take that stance and you follow it through, you have a much better opportunity for having compliance throughout your department, throughout your area. Okay.
Okay.
Utilize monitoring and auditing systems to detect non-compliant conduct. This is very good. If you're working in a hospital that may have CAC, computer assisted coding, that's a great way to audit claim forms before they get sent to make sure that everything is kosher, as they say, before you are putting your facility at risk or yourself. If not, if you don't have software to do this, then you can do the buddy system. You can do internal auditing where you maybe one day a month randomly pull claims that have just been finished and audit them, check those codes and make sure that they're right and that they are supported by the documentation in the patient's chart. So this can be done technologically, electronically, or this can be done manually. But when you do that, even if something illegal gets through, you can prove that you've done everything you can to be compliant. You have this written compliance plan. You have these meetings, you have these trainings, and that automatically can reduce the fines and penalties as much as 75% on the other
Wow.
end. Okay. The government and the fraud detection teams are not looking to get you. They are looking to create environments of honesty. So when you prove, yes, we had this coder who was not very good at their job. We did an audit. We found him after only 3 months and we send him back to school, or we did training, or we fired him, whatever is appropriate. Okay.
Okay.
When you can show that, you can prove that, that's a good mark on yours. Okay. Very, very important to find your own mistakes and correct them. All right. Enforce adequate disciplinary sanctions when appropriate. I don't know if you've ever been a parent or just in general life. We know that when you say don't do this, it means something to some people. But when you say don't do this, or here are the consequences of doing that, now you got some fist in that glove, as they say. So you must have consequences for misguidance, for non-compliance. You need to do this, and you need to make sure that they are applied. You find somebody who is doing the wrong thing, you must punish them.
Mm-hmm.
Now, I'm not saying fire them on the first day, depending upon what they did, of course, okay? But you can, like, I'm sure you probably had jobs where when you look in the employee handbook, it says, you know, if you're late twice, we're going to write you, we're going to say, don't do this anymore. And if you're late the fourth time, we're going to put in a note in your employment file, which means when next time you're up for a raise, you're not getting it. And then if you're late 10 times, you're fired. It's
Mm-hmm.
fine to have that, a tiered consequences. We're not telling you to chop their head off right there in the first day, although sometimes. But the point is that you have to take it seriously enough to impart these consequences. Or people will say, well, so what if I'm late? She won't care. She never says anything, right?
Right.
And then guess who gets in trouble, just in case you want to know how it is to be the lead coder or the head of the department. The fact is that the executive suite of the facility is going to come to you and say, why are we so far behind in claims? Why are we not sending out claims? Why aren't we keeping up with this? And then you're going to say, well, that's because, we only have 3 coders and 2 of them like to take 3-hour lunches. And, Mary Lou over there, she's a single mother. And so, and Joanne, well, she's just the nicest thing and she brings candy in for all of us. I can't discipline them. Right. Exactly. So you know what? Then you're going to learn about discipline. Yeah, from your higher ups, from your supervisor. Okay. And everybody always has a supervisor. Just say, even the CEO of the hospital has a supervisor called the board of governors or the board of directors. And you know what? They have supervisors, which, at the very top of this heap is the federal government. So
True.
the point is that if honesty and doing your job does not roll downhill, the poopy scoop will roll uphill right into your face. And nobody wants that. Okay.
Mm-mm.
My biggest emphasis when I go through things like this is the fact that if somebody's always late, leaves early, takes 3-hour lunches, if somebody has the highest denial rate of all their claims, okay, if somebody's not doing a good job, I'm not going to tell you to fire them. What I'm going to tell you is this person needs a different job. Because that's not a happy person in their job. When you're happy in your job, you're happy to get there on time. You plan things out properly. And also, while I don't believe in managing by fear, a little bit of fear isn't so bad. If you have to say, if I don't get to work on time, I'm going to get fined, or I'm going to get docked, or I'm going to get in trouble. Okay. The thing is that every supervisor, every department chair or whatever, you have to find your own way of handling things. And I don't know if you've ever heard the old saying, it's lonely at the top. But one of the things that emphasizes that saying is the fact that you can be friendly with your staff, but you cannot be their friend, because you got to be their boss. Because without a boss, what happens is there's nobody steering the car. And then that's just looking to crash. And I'm not insinuating that you're all in one of those self-driving cars, because we're not there yet. But the fact is that in real life, organizations aren't like that. We don't have self-driving departments, especially when you have people coming from all different backgrounds. Humans have different skill levels. You know this just from looking at the other students in your class, right? We have our A students in our class, we have our B students, we have our C students, we have our D students, we even have maybe an F student. I'm not mentioning any names anywhere, because that's not the point. The point is that this is a reflection of real life.
Mm.
So I know it's really hard, especially when you have somebody, and I have been through this, I have been down this road where I'll tell you a quick story. I was employee at this organization. It was only about 30 people in the entire company. So it wasn't huge, but it wasn't teeny tiny anyway. And there was this one mid-level manager. And this woman, and we were friends, actually. I was not her supervisor or anything. But this mid-level manager could not get to work on time no matter what. There was always an excuse. Oh, traffic was really bad, or I had to drop my kid off at daycare, or this, that, 17 other things, okay? She also was the first one to go to lunch and the last one to come back from lunch, and she was the first one out the door at 5 o'clock, okay? Everybody knew this. Then came the time for annual reviews. And she gets called into the boss's office, and the boss was the owner, okay? And the boss, and then she comes out, and so everybody is like, oh my God, because we're all expecting her to get fired, right? Because this company had a strict, you must be on time, you must do your work thing, right? Okay.
Mm-hmm.
Well, she comes out of that meeting, and what happened? She said, well, he told me that I was only going to get a little raise because I was late all the time. Now, let me ask you something. And I know you are honest, good, hardworking people with a good work ethic, okay? I'm a good, honest, if I have to be there at 9 o'clock, I'm not. I'm there at 8:45. Okay. How would you feel when you make it your business to be there on time every day? You make it your business to get back from lunch in an hour, like you're supposed to. You make sure to get your work done, and you never left at 4:59, much less right at 5 o'clock. And you do this because you're responsible and an ethical person. And here you find out that somebody who is irresponsible and unethical and does whatever she wants whenever she wants, and she gets a raise. How do you feel?
That's not a company I want to work for.
Exactly. That's like a slap in the face, right?
Yeah.
That's just saying right out, good for being the rules person, but the rule breakers get rewarded also. And I will tell you that it was really amazing the attitude that seeped through this company after she came out from her review, because all these people that were responsible people that worked hard to do their jobs properly, that really cared,
Mm-hmm.
were all slapped in the face at the same time. So I want you to think about that when you're the manager and you have to discipline somebody for not following the rules. And you have to have these rules, by the way, because otherwise charts don't get coded, claims don't get sent out, no money comes in, bad time all around. Okay, and that leads to the last one, which is respond to episodes of noncompliance by modifying the program if possible, if necessary. Okay, so what that does is that says if this rule is too difficult to follow, we need to find a way to adapt. Okay, so let's say you have an employee who is a single mother of a young child, and she cannot seem to get to work on time, and she always has to leave early to go pick her kid up from daycare. But she's really good when she's there. She's really good. So maybe you find a way and say, okay, I'm going to take your lunch hour away. You're going to stay here, work through lunch, eat at your desk. And that way we make up the time. Or maybe you have someone else where it's like, okay, well, I'll tell you what, work this out with your husband or a friend, neighbor, the parent of the kid's best friend, and say, well, I'll work from 7 to 3 or 8 to 4. I'll let you change your schedule so you're still getting the time in, you're still getting the work done. And you can arrange with, well, I'll take the kid to daycare in the morning, you pick them up at night, whatever it is, okay? That's what I mean by modifying, okay, is you don't want a compliance plan that's made of wrought iron steel, okay? You need to have some give into it because these are people and things change. But there's always a way with a little creative thinking. There's a way to comply with the law, not break the law, and still keep your people happy, still keep everything working smoothly. Okay? Sometimes you got to make the people fit in the box, and sometimes you got to make the box fit to the people. But the bottom line is we have to keep the federal and state government happy, and along with the Joint Commission, because otherwise. And most importantly, remember that while we look at some of these laws and say, oh, they're ridiculous or they're stupid or they just created them to annoy us, which I'm not going to argue with that one. But the fact is that the bottom line on everything is to make sure our patients are protected. And if you need a motivator for that, here it is. Every one of us at some point becomes one of our customers. Okay. At some point in your life, you're going to be lying on a gurney in an emergency room. At some point in your life, you're going to be lying in a hospital bed. At some point in your life, you're going to be sitting on that paper on the exam table, waiting for the doctor to come into the exam room. At some point in your life, you are at the mercy of people who do your job. We have to set the standard high. We have to make sure that we are protecting our patients, and then we can only hope that what goes around comes around, which it does. When we're the patient, we'll be taken care of properly also. And that's your catch-all. Okay, questions? All right.
No, ma'am.
Yeah.
No, ma'am.
No, ma'am. Okay. All right. So week 6 discussion is, interestingly, about healthcare compliance programs. Who knew? Okay. And you follow the link, you look at all the tips, and you pick out something that interests you. Maybe something that relates to your job now. Maybe you could carry this with you to your job and share it with your manager or supervisor, or maybe it's for later on. But pick something, and then how would you use that tip to promote compliance in your facility or in your department? Okay, so this gives you a little bit of hands-on with this. All right, then
Okay.
you got chapter 6 to read the 4 C's of medical malpractice prevention. Now, as you're reading this chapter, I know a lot of it doesn't appear to relate to you all, because we're coders, we're in the health information management department, and but take a look at it from the more you know about what the doctors and the nurses need to do, the better you can be at participating in a positive environment in your facility. Remember that one of our jobs in reviewing those charts is that we are the clinician's backup. We look through these charts and we see the documentation of what's going on. And when you notice, oh, wait a second, this This doctor ordered chemotherapy for a patient who's expected to die in 3 days. She's in hospice. Okay. You know that's wrong. Maybe you can bring it to light and let other people know it's wrong and stop it from happening. Okay. Because when you have the knowledge, you can act upon it. And then that helps make everything be better. Remember that old saying, which is evil succeeds when good men and women do nothing to stop it. Okay. All right. You got your review, you got your assignment, your homework, and some compliance guidance, more linking to provide you with all the information, news you can use. Okay. All right. You know how to reach me. You know I'm here for you. You got any questions?
Now, I'll email.
I look forward to it. All right. Thanks for joining me. Have a
All
good
right.
night. Stay safe
You
and
too.
and stay warm. I don't know if it's coming to South Carolina. I know it's going from Texas, Oklahoma. The big storm is whipping its way up to the northeast.
It's in Tennessee. My one of my friends, she sent me pictures. So
Oh,
she can't come back
oh,
home.
yeah.
She
I
said,
just
I'm
spoke
stuck
to a
here.
friend of mine who's in Oklahoma, and they said 5 inches and another 5 inches expected tomorrow.
No,
Yikes.
it's supposed to warm up here in South Carolina. And we're supposed to get some more rain starting, I think Thursday into Friday morning.
Well, at least it's good for the spring plants.
Yeah.
All right. Have a good one.
You too.
Bye.
Bye bye.